I think for that, before I go to Senator Hickenlooper, I'll notice for the first time in this hearing you smiled when you asked about antimicrobial resistance. You know what I'm saying? Like, it was just a sweet spot for you. So, Senator Hickenlooper.
Dr. Monarez, thank you so much for your public service, and obviously your dedication and commitment to the work you're doing is noteworthy and I think laudable. You obviously have a lot of experience in technology research and development, including how to identify and treat infectious diseases. How would you incorporate this experience in, as you know, if you are confirmed for this position?
Thank you. And again, thank you for taking the time to meet with me. I know there's a lot going on in here, so I appreciate all of your time in meeting with me in advance. So I do have almost 30 years of experience in science, technology, and innovation. And what I will do if I'm confirmed with this as the CDC director is I'll want to make sure, as I laid out in my priority, is that first that we are incorporating the latest and state-of-the-art technologies into the work that we're doing within CDC, that we're modernizing our laboratory capabilities, that we're investing in diagnostics with the level of sensitivity and specificity that if there is an urgent outbreak, that we are able to support our state and local public health officials with accurate diagnostics so that they can differentiate between individuals who are worried and those who are truly in need of medical intervention. It helps us prioritize resources, and it helps to make sure that we're keeping American people safe. I will also bring in AI technologies to help in a couple of different ways. When I think about AI, the first thing I say is, what problems are we trying to solve? And when you can define accurately what the problems are you are trying to solve, it allows you to have a disciplined way to incorporate these technologies that are really transforming what we think about in health innovation. I'll be using AI technologies to help support CDC to create a modernized and operationally efficient organization where we look at how do we optimize our workforce, how do we make sure that our IT is supportive of internal operations and partnerships with state and locals, how do we make sure that we achieve fiscal responsibility through accurate tracking of all of our resource expenditures. I'll also be incorporating AI technologies as we continue to support public health outcomes. So the areas that AI I think is going to be transformative in the health ecosystem is where we can work internally and with our partners to say—
That's good. You know, I've got another question. I apologize. I hate cutting you off. I love talking technology.
Well, I look forward to following up with you if I'm confirmed.
Exactly. And in contrast to some of my colleagues across the aisle, I am very concerned about the cuts to Medicaid, certainly aware that there are always improvements, and you can find examples of fraud, waste, and abuse in pretty much any— I've been a mayor, I've been a governor, we're always dealing with that. It's a constant struggle. It's the same in any corporation, to be quite blunt. But I think that Medicaid is essential to community health centers. I helped start a community health center, we discussed a little bit, way back in 1972, 1973, that now has over 200 locations, is an essential part of providing access to health care, in this case all across the state of Connecticut. For them, Medicaid is essential to being able to provide that care and be compensated for it so they don't collapse financially. And I think it's amazing that in Colorado, we're besieged by concern from rural healthcare providers, from community health centers, that if these cuts go forward, they will be in peril of going out of business. Do you see any solutions, or how can we address this potential issue?
So that is a very critical issue. I had an opportunity in a previous role to really come to appreciate the value that these federally qualified health centers and rural health clinics play. And sometimes they're the only health that is accessible for some of our rural and vulnerable populations. And I do think fiscal viability of these has always been a challenge in making sure that although they operate on a very thin margin, that they're able to continue to support and keep their doors open to help the population that they serve. As the CDC director, I don't know that I'll have a great deal of influence or ability to shape policy related to the health centers and to rural health clinics, but they are a very important part of our health ecosystem.
Right. Well, certainly disease control, you've got to be able to have access to healthcare, as you pointed out. And I think you'll be surprised how much influence you're going to have. You know, just your range of experience and your approach to what you're doing is going to give you, your voice is going to carry further than most. Anyway, I yield back to the chair.